Today we're going to talk about the revised mouth care screening sheet, the mouth care assessment tool and the daily recording log. These assessments have been adapted from the Mouth Care Matters NHS England document. Let's look at the mouth care screening sheet. This screening tool needs to be completed on admission or within 24 hours of admission for every patient. For ease of use, you may want to complete it at the same time you do the skin assessment or perhaps MRSA screening. It's the registered nurse's responsibility to complete the screening tool. So let's use a patient as an example. We've got an 89-year-old female. She is able to communicate, but due to a previous stroke and arm weakness, she is dependent on others for full mouth care, making her more vulnerable. She has upper dentures only, and as she came in as an emergency, she did not bring a toilet bag with her. So let's look at the assessment for this lady. So does she have a toothbrush? No. So we're going to tick that, but then we're going to tick when we've provided her with one. The same for a toothbrush. We're going to tick no because she didn't bring them in, but tick when these have been provided. She has an upper denture, so we're going to tick yes. Then there's a question, is the denture named? We would like you to include the patient's name on the denture. So please check the denture if their name is already written on it. If not, please write on the patient's denture their name using a body marker pen. These are the pens used by surgeons. They're single-use pens. The reason for this is that loss of dentures have a massive impact on the dignity of a patient, their ability to eat, and for the organisation itself, the cost of denture replacement is now in excess of £2,000, which KGH would have to pay. So once we've named it, we're then going to tick yes. She hasn't got a lower denture, so it's no. The denture's not named because she hasn't got any. And she has got a denture pot that she's brought in herself, and we're going to make sure that that's named, usually with an addressograph label. So we're going to tick yes. Please be aware that patients that have no teeth, are nil by mouth or dysphasic, will still require regular mouth care. So we're now going to look at part 2 and part 3 of the assessment. So we're going to ask the patient or assess, does the patient have any pain or discomfort in the mouth? In this case, the lady can communicate, so we can ask these questions. And in her case, she does have a severe dry mouth, so we're going to put a tick here next to the yes box. If when you're assessing a patient, none of the above apply, then we're going to tick here. So part 3 of the assessment, which you can see is all red, if any of the patients have any of these factors, they then will require a mouth care assessment. And for this lady, she has had a stroke, so we're going to put a tick here. If none were relative, we would then put none there. So because we've ticked some red boxes, this patient does require a full risk assessment. The patient is dependent on others for mouth care, so a mouth care assessment is required, and then we're going to record the mouth care on the daily recording sheet that we will come back to. So we'll put a tick. If in other instances the patients were unable to get to the sink or needed some degree of assistance, such as a bowl or encouragement to clean their teeth, we would tick the yellow box indicating that they need some assistance. If the patient is completely independent, we would tick this box. We then want you to sign, print your name, put the date and job description. So let's move on now to the full risk assessment. A full risk assessment or mouth care assessment is really important, and it plays a vital part in looking after our patients. Sometimes patients are unaware of problems in their mouth. Mouth cancer is on the rise. The earlier it is detected, the better the prognosis. So assessing the patient's mouth in hospital is very important. The side of the tongue and under the tongue are the areas most at risk, but mouth cancer can develop anywhere in the mouth and throat. When undertaking your assessments, if you find or notice any white or red patches, any lumps and bumps, any ulcers that have been there for more than 2 weeks, or anything that feels unusual, please get it checked by the doctor. So from a form perspective, we're going to add a patient label. We then need to be aware that the assessment needs to be completed weekly. It is the registered nurse's responsibility to complete the screening tool. There's 5 elements of the patient's mouth that we're going to assess, and they are the lips, tongue, teeth and gums, cheeks and palate under the tongue, and the dentures if the patient has any. This includes full or partial dentures. Use a pen torch to assess the patient's mouth because it's much easier for you to see. If the patient's wearing any dentures, please remove these first. We're then going to score each patient using the low, medium or high risk element. So I'm going to come back to this lady's assessment in a moment, but I just want to show you some slides that may help. So if we look at the lips, we're looking at, are they pink and moist? Are they dry, cracked? Does the patient have difficulty opening the mouth? Are the lips swollen or ulcerated? And there will be these posters around for you to use as a visual prompt and to aid your assessment. When we're assessing the tongue, is it pink and moist? Is it dry? Are there fissures? And is it shiny? So these little lines here are fissures. Does the mouth look abnormal? Is there white coating? Is it very sore and ulcerated? And as you can see from the pictures, the green, amber and red link to low risk for green, medium risk yellow and high risk red. Teeth and gums. Are they clean? Is teeth not broken? Haven't got any loose teeth? Are they unclean? Are the teeth broken but they have no pain? And are the gums bleeding or inflamed? And then from a high risk perspective, does the patient have severe pain and is there facial swelling? If we then move on to the cheeks, palate and under the tongue, do they look clean? Is saliva present? Do they look healthy? Or is the mouth dry? Are there sticky secretions, food or debris? And are there ulcers, mouth ulcers, tongue ulcers that have been there for less than 10 days? If somebody is at high risk, is the mouth then very dry? Is it painful? Have they got mouth ulcers that you know have been there for longer than 10 days? Is there widespread ulceration? And does the mouth look abnormal? From a denture perspective, are they clean and comfortable? Are they unclean or loose, or the patient will not remove them, or are they lost? If the dentures are lost, please do a Day-Tex. If they're broken or unable to wear, then please refer to the dental team. So now let's go back to our assessment. So if we then think about our patient, As we're assessing her, we've found that her lips are dry and cracked. She can open her mouth, but her lips are definitely dry and cracked. So we're going to put an M here. Obviously the date first. So in this instance, let's say the 25th of the 1st, 2024. We're then going to move down and look at her tongue. It is dry. There aren't any fissures and it isn't shiny, but it is dry. So we're going to put an M for medium risk. If we then look at her teeth and gums, we know that she has got an upper denture. So we're going to look at the other teeth. They are clean, they're not broken, and they're not loose. So we're going to put an L there for low risk. Then when we look at her cheeks, palate and tongue, her mouth is dry. There aren't any sticky secretions. There is one ulcer that you've found, but she says it hasn't been there longer than 10 days and there is no food debris. So we're going to assess that there as an M for medium risk. And then if we look at her dentures, they are clean, but she has said she has lost weight recently and they do appear to be a little bit loose. So we're going to put an M there. So if we then look at what actions need to be taken, as you can see on the bottom of the assessment tool, if a patient does require dry mouth care, and you will see under each point what action needs to be taken. And so for this lady, she will need dry mouth care, teeth brushing twice daily, clean the mouth and dry mouth care again, and ulcer care. She'll also need denture care. We need to encourage dental fixative and encourage removal of her teeth. So we're going to sign when we've finished the assessment. So the action you need to take for patients that need dry mouth care, offer frequent sips of water unless they're nil by mouth. Moisturise the dry mouth by putting the gel onto the tongue, cheeks and palate. Hydrate with a moist toothbrush. Apply lip balm to dry lips and keep the mouth clean. For patients that have or require ulcer care, we advise that you rinse the mouth with saline, anti-inflammatory mouth spray, and discuss with the doctor if the ulcer has been present for more than 2 weeks. For all patients that have dentures, we advise that the patient is to leave the denture out at night in a named denture pot with lid. If they have oral thrush, soak the dentures in 0.2% of chlorhexidine mouthwash for 15 minutes twice a day. Rinse thoroughly and encourage the patient to leave the denture out while their mouth heals. The patient may want to make some form of assessment themselves if they're able to, because they may want to put it in when they are eating. From a denture perspective, we also suggest that dentures are stored in a dry denture pot unless the patient has any objection. And then prior to putting the dentures in the mouth, then moisten them with water and then pop them back in. So we've undertaken the assessment. We're giving the care to the patient, so we need to document what we are doing. So this is the full documentation sheet, and let's just zoom in a little bit. So again, a patient address, a graph label. We then want you to put the date and time you gave the mouth care and what action was taken. Now we've given you some abbreviations here that can help when filling in the actions. So you could put the date and time, so the 25th of the 1st, 2024, 1800 hours. The action is an A because we've done assessment. And we've also given some dry mouth care. So we would then do DMC. We're then going to sign and print our name. And then every time you do mouth care, whether it's an assessment, you're giving dry mouth care, toothbrushing, etc., you would just fill in what you've done. As we've said previously, if there is a change in the patient's mouth condition, then you would reassess and document accordingly. Let's just reflect on some key points. The screening tool and assessment needed is to be completed within 24 hours of admission. The patient should be reassessed weekly or when their condition changes. Ensure that your documentation is comprehensive, so it's in detail. Ensure that a DATEX or incident form are completed for any lost dentures. For guidance regarding teeth brushing and mouth care matters, there is some ESR training that you can find on Training Tuesday. You can also access mouth care training through ESR, which will take you through some information and assessing your knowledge at the end. Thank you.